Traditional Chinese medicine in the United States is not considered an essential medicine. In fact, it's not even widely recognized throughout the country. But in light of COVID-19, China has been using Eastern and Western medicine to improve the health of those patients who have become either mildly or severely affected by the virus. Let's take a closer look at how China is healing their country.
How has traditional Chinese medicine helped China fight COVID-19? In TCM, there is no such term as pandemic. Instead, in TCM, highly infectious diseases are referred to as pestilence. As such, the name of COVID-19 according to TCM should be pulmonary pestilence. In China's fights against SARS and the H1N1 influenza in recent years, TCM has indeed played an important and effective role in treating affected patients. Compared with Western medicine, TCM treatment usually does not focus on the virus itself, instead focusing on adjusting the body's immune system to clear symptoms and reduce complications.
Did you see the part where the doctor was looking at the patient's tongue? That's called telemedicine. Practitioners all over the country are offering this service to where we can speak to you through a Zoom call and prescribe herbal formulas and share with you how you can improve your situation. It doesn't have to be related to COVID, but this is how we can work with patients across the country.
China has adopted a combination of Chinese and Western medicine in its fight against COVID-19.
Now pay close attention to the statistics in this next portion of the video. The numbers are enormous and everybody's wondering how China has this epidemic under control. This is how they're doing it.
During the epidemic, over 630 TCM hospitals across the country sent nearly 3,200 medical staff to Hubei. Moreover, the state administration of TCM sent an expert team led by 3 academicians, Jiang Boli, Wang Luqi and Tong Xiaolin, and 4 national TCM teams comprising a total of 588 people to support Wuhan. In the latest novel coronavirus pneumonia diagnosis and treatment plan, lung cleansing and detoxifying decoction was listed as the first choice in the clinical TCM treatment. As of March 13th, 1,261 patients in 10 provinces had taken the decoction, and its effectiveness rate is 97.78%.
What? That's pretty astonishing. So if they're getting such great results, how come we're not incorporating this medicine into our hospitals today? There's been talk that the pandemic could get worse in the winter and the fall, and it could come back around again. But look at what they're doing and let's learn from what is working in China.
Patients can be categorized into 4 types according to the seriousness of their sickness: mild, moderate, severe, and critical. It was found that the number of cases evolving from mild to severe when being treated by Western medicine treatment was about 10%, while the rate under integrated Chinese and Western medicine treatment was about 4.1%.
Those numbers are suggesting that when we incorporate traditional Chinese medicine with Western medicine in this pandemic specifically, the results are more than half. So imagine when we incorporate traditional Chinese medicine into conditions with people who are dealing with heart disease, diabetes, in addition to nutritional programs and working with a coach, changing your diet, including exercise into your lifestyle. Imagine how quickly the body will recover by using both medicines. It is time to integrate traditional Chinese medicine and Western medicine. We have no time to lose.
几乎100%的方舱医院都进了中药，也都吃了中药，整体控制结果是不错的，大大降低了转为重症的比例。早期的使用往往可以起到力挽狂澜的作用。
For critically ill patients in the ICU, Western medicine is the main treatment, and TCM takes a supporting role. In terms of reducing organ damage and enhancing physical strength, TCM wins more time for Western medicine treatment. The treatment is relatively simple, using mainly TCM and a few IV infusions. In addition to taking medicine, there are many special practices such as Tai Chi, Baduanjin, acupuncture, massage, and pressure point application, which are all TCM treatment methods.
So he was just explaining the 5 modalities, the 5 branches of Chinese medicine: exercise therapy, massage therapy, herbal formulas, nutritional therapy, and acupuncture. This, all 5 branches, that is traditional Chinese medicine. That is what a traditional Chinese medicine achieves to do when they're working with you. That's what they incorporate all 5 branches in order to help bring the body back into balance, to help you understand exactly how your body is working and how you can create and incorporate self-care practices in between treatments. This is profound. This is what nature calls for.
Although the hospital was managed by a TCM medical team, modern medical equipment such as testing equipment and mobile CT scanners were used. As of March 15th, the proportion of treatment that included elements of TCM in Hubei province overall was 91.64%. The proportion of TCM included in treatment in Wuhan was 89.10%, and the proportion of TCM included in treatment across the country was 92.41%.
You see, China is overcoming this pandemic, and people across the world, other hospitals and other communities are starting to learn from China's experience. So if we can also incorporate traditional Chinese medicine into hospitals and treating patients who are in critical care, this pandemic can be lessened and we can return back to normal life.
Daejeon University in South Korea, Toyo Medical College in Kobe, Japan, and a medical school in Rome, Italy, expressed their willingness to share their experiences with China and hoped that China could send TCM teams to help them fight the pandemic. At the same time, China has also sent teams of medical experts with medical supplies and TCM prescriptions to countries including Iran, Iraq, and Italy. TCM can play a low-cost role globally in terms of helping people fight COVID-19.
My point is, traditional Chinese medicine is essential. And you can start learning about how this medicine works simply by experiencing the use of aromatics. Aromatics are a part of the Materia Medica. And in the Materia Medica, there's over 45,000 herbals that are studied to help bring the body back into balance. So the beautiful thing is, there is a solution to helping people survive and thrive through this pandemic. Begin your lifestyle, begin this next step, this next chapter in your life, incorporating plant-based nourishment into your day-to-day routine.